Welcome to COVID Q&A, your questions, our answers. Today I'm sitting down with Dr. Pamela Allen, who is an associate professor and the vice chair of the Department of Dermatology at the Health Sciences Center, as well as the director of the residency training program. Dr. Allen will be answering a few frequently asked questions today. Dr. Allen, the question that we have for you is, what is maskne and what can I do to prevent it?
So maskne is a new term that's catching on. It's a play on acne, but it's basically breakouts that can happen under the mask and those who are wearing it for long periods of time. And so we know that under the mask, there's this microcosm of vaporized air, respiratory droplets. There may be sweat if you're hot, but also makeup that may be underneath the mask, and all of that clogging your pores over hours of time will develop into acne breakouts. And it can be itchy, it can be burning, it can be stinging, and it can occur in the areas where the mask is resting. Sometimes people along the jawline and cheekbones where the bands and strands are being held, you can also get irritation there as well as around the nose. And so what can a person do to ensure that they don't have breakouts or reduce the amount of breakouts? One thing is, as soon as you get home and you removed your mask, go ahead and wash your face with gentle cleansers. There are some acne cleansers that are over the counter that contain benzoyl peroxide, which is antibacterial cleanser, and that'll help to just cleanse and get rid of any bacteria that may be on the skin, clogging in those pores as well. And most of the time, we as especially physicians and those in industries that have to wear masks all the time, we're not wearing a lot of makeup. And so for our females, you may not want to apply makeup from the 2/3 down of your face. And that will help as well, just to keep a clean face. So that's one of the ways that you can definitely clean your skin. And one thing, when it's stinging and burning, don't use alcohol on your face. Don't use witch hazel or any exfoliative scrubbing beads. Those will just make things more irritated.
All right. Well, thank you so much for your insight. We appreciate your time.
Thank you.